Hey students, this is Carol from IPO. I wanted to let you know that there have been some big changes to how you purchase the LCSC required insurance. If you're an athlete, I'm sorry, this presentation is not for you. Please contact the Student Health Center for specific information about health insurance for athletes. In the past, students were automatically charged a health insurance premium. Now you have to find your own. Because insurance is so complicated, IPO did the research for you and found an insurance policy that's not only better than SHIP, it's cheaper. It's called PGH Global. The PGH policy meets all of the needed requirements. The price that you pay is determined by your age. Since most of our students are 24 years or younger, the cost will be $85.50 per month. That is less than half the cost of the SHIP plan. This is good news. Okay, so let's compare SHIP and PGH. The deductible for PGH is $50. With SHIP, it was $400 up to the first $2,500 in services. After that, if it was more than $2,500, your deductible rose to $5,000. For coinsurance, PGH pays 90% with a preferred provider. SHIP paid 80%. The emergency copay, which is the amount you would pay up front if you were to go to the emergency room, it's $150 with PGH and it was $100 with SHIP. The out-of-pocket maximum, which is the most that you would pay, with PGH it's $5,000, with SHIP it's $6,350. Prescription costs with PGH range from $15 to $50. And with SHIP, it was $25 to $75. With PGH, when you go to the doctor, you're going to pay $20 each time. With SHIP, it was 80% of the cost. In general, although only one of the costs was a little bit less with SHIP, overall your costs with PGH are much lower. So I just used a whole bunch of words that most Americans can't even define. Let's see if I can break it down for you. Okay, so a deductible is the amount that you pay for healthcare services before your health insurance begins to pay. Coinsurance is your share of the cost of a healthcare service. It's usually figured as a percentage of the amount charged for services. So in PGH example, they're going to pay for 90%. You start paying coinsurance after you've paid the $50 deductible. The emergency copay is a fixed amount that you pay for a healthcare service, usually when you receive the service. The amount can vary by the type of service. You may also have a copay if you get a prescription filled. So again, for emergency room, it's $150. If you just go to the doctor's, it's going to be $20. So what is an out-of-pocket maximum? That's the maximum amount that you'll have to pay for the duration of your policy. So in the case of PGH, if you have an insurance bill of $10,000, the most that you're going to pay is $5,000. And what's a prescription? That is just medication that's ordered by your doctor and usually go to a pharmacy to pick up. Also, what's a preferred provider? That's really important. Preferred providers are doctors or hospitals that have agreed with PGH to take their insurance. So when you go to those doctors, they're going to pay 90%. If you go to a doctor who's not a preferred provider, PGH will pay less. A few last words on preferred providers. You'll see a list of primary care doctors in Lewiston on the PGH website. See the little red arrows on the slide? A primary care doctor is a physician who can take care of most of your common medical issues. If you have a problem that's more complex, the primary care doctor will refer you to a specialist and will coordinate your treatment with the specialist. Now, let's discuss how you can make the purchase. When you go to our website, which you see listed in item 1, you can download a PDF that also has step-by-step instructions. So when you go to our website, all you need to do is click the Buy Now button, and then you're going to click the Quote and Buy PGH Global Preferred. From there, you're going to see a dialog box that looks a lot like this, or looks exactly like this actually. From there, you can read the policy brochure, which has detailed information about what is covered and what is not covered. You can look at the policy flyer, which is a condensed version of the information. Then you want to click on the little red box at the bottom that says Select Plan. Next, you're going to see a screen that looks like this. Go ahead and enter your email address and confirm it. Select the academic year 2015-2016. Then put in August 15th, 2015 as your first day of coverage. This is recommended because the SHIP policy ends on August 14th, 2015. For your end date, enter January 18th, 2016. This is recommended for college students and IIE students who plan to continue on to Fall 2. IIE students who do not plan to stay on for Fall 2 and who do not plan to stay in the U.S. during their 60-day grace period should enter November 15th, 2015, or purchase short-term insurance, which is available only to students who will be studying for less than 3 months. You can find more information about short-term insurance on our website and on our YouTube channel. So, once you've entered your information, and don't forget to enter your date of birth, click on Proceed to Product. After you've clicked Proceed to Product, close your browser and then log back in by clicking where the arrow is pointing. Once you've logged in again with your username and your password, go ahead and re-enter all of your information and then click Proceed to Product again to actually go and select your plan. One thing to keep in mind, that once you have finished this process and you've paid for your insurance, it is non-refundable, so think about that when you're selecting your end dates for your coverage. You're then going to be taken to a page where you can pay the premium. You'll see that depending on the coverage dates that you selected, there'll be an amount, a price that you're going to pay. Fill out your payment information, and then you're done. You'll be able to log back into your account in a couple of days and print your ID card. Now that you're covered, all that you'll need to do when you go to the doctor is present your identification card. Hopefully the physician will go ahead and submit the bill directly to PGH. If they don't, you'll need to submit a claim form yourself. To file a claim, make sure that you have the original itemized bills and the payment receipts. You're going to send those along to the company, and you can download the claim form by clicking here. Note that you do have to file a claim within 60 days of the end of your policy. If you wait longer than that, you will not get your money back. So in this presentation, I have given you just a very small snapshot of PGH Global. I recommend that you go into their website and you take a look at the costs, what they cover. They also will define more terms than I did in this presentation. They also have a page where you can find a preferred provider and or hospital, and they also have information about how to file your claims. So remember, if you have any questions about this, you're always welcome to ask me. Now we're going to talk a little bit about short-term insurance. We have found a plan called the E+ plan, and this plan is for students who are attending less than 3 months. The policy does not meet the requirements of the Affordable Care Act, and it does not meet LCSC requirements for medical insurance. However, if you're studying for less than 3 months, LCSC will allow you to take a short-term insurance policy out. As you can see from this screen, although it's a short-term plan and covers fewer services, it is a little bit more complicated to figure out which one to purchase. What we're going to do is we're going to compare it to the PGH plan for your information. So here's the comparison. With PGH, there's $50 deductible. With E+, it's between $0 and $500, and you actually will choose which one you want. With PGH, the coinsurance is 90% with a preferred provider. With E+, it's 80% up to $5,000, and then 100% after $5,000 up to the selected medical maximum, and you are going to be selecting the maximum. If you go to the emergency room, with PGH it's $150. With E+, it's 80% up to $5,000, and then 100% up to the selected medical maximum. Your out-of-pocket maximum with PGH is $5,000. With E+, it's 80% up to $5,000, then 100% up to your selected medical maximum. Once you've reached your selected medical maximum, you have to pay the entire rest of the cost. You'll also notice that E+ does not cover prescriptions, and for doctor visits, they are 80% of cost instead of $20 as with PGH. With the E+ plan, you can choose the maximum dollar amount of the policy and your deductible. The maximum amount is the most that the insurance company will pay for your medical services. So for example, on the first one, if you select a maximum of $100,000 and your medical bills are $200,000, you'll have to pay the other half of your bill, which is going to be approximately $100,000. Remember also that the deductible is the amount that you pay before insurance begins to pay. So you can, if you pick a $500 deductible, remember that you're going to have to pay that before insurance begins to pay. If you select zero insurance, a zero deductible, the insurance will start paying immediately with your very first doctor's visit. So we recommend that you purchase the highest maximum that you can, and on this policy the highest is the $1 million, which you can see in the lower right hand corner, and we recommend that you choose a zero deductible so that you don't get caught at the doctor's office being sick and without any money. So now you know a little bit about the two new policies that we have found for you, depending on your length of stay with us at LCSC. But don't forget that there's no cost to you at all if you go to the Student Health Center. So I recommend that you go there first and then go to another doctor or a hospital if they tell you that you need to. Here's a map of some of the local clinics. The Lewis and Clark Clinic is the closest, and they also have a sliding scale, which means that the cost of the services depend on your income, and they also have a pharmacy right there, which is convenient. Their hours are 8 to 6. And one thing you need to know about them is you need to establish yourself as a patient with them before you're first seen. There's also Clearwater Medical Clinic, which is open from 8 to 5, and there's Valley Medical, which is a little bit further away, but they have more expansive hours. They are even open on Saturdays. And they also have an express care center for if you were to have a slight emergency. Thanks for listening to this presentation. I hope that you found it helpful. Please let me know if you have any additional questions after you have looked at the frequently asked questions listed below. Take care.